Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon, founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And as many of you know, I developed and created a surgical technique called the vertical restore. It's my sort of contribution on the next level of facelifts. It's been a work in progress over nearly 15 years. And what it accomplishes is an extremely natural but impactful high-level outcome that really is powerful and beautiful, and people from all over the world come to see me for that particular procedure. There's lots of questions that come up as a result of that, and what we're gonna do today is field your questions, and I've taken about 15 of them that you guys have asked along the way in different places, along the comments, etc. And I just took 15 of them and I'm going to answer them one by one. And these are questions that you guys have asked. These are answers that I'm going to give you and hopefully give you a little bit more insight. And all of them are great questions, by the way. More insight into the vertical restore and what it's all about. All right, so let's start with question number one. Do I combine laser treatments with the vertical restore? So as you know, a basic principle of mine is that there's skin changes with aging, there's volume changes with aging, and then there's sagging changes with aging. So when it comes to sagging, we're talking about vertical restore to bring up the laxity of the jawline, neck, mid-face, lateral brow together. That is effectively what a vertical restore is. And let me actually back up for a second because I failed to mention this earlier. What makes the vertical restore unique is it's a deep plane facelift. It's a different vector than what your traditional deep plane is, meaning that it's less like this and more like this. It also incorporates a lift in the lateral brow section, and it incorporates a neck lift in every case. So it's a neck lift, jawline, mid-face, lateral brow lift, all combined together in the deep plane, which for all of you who know, the deep plane is the longest lasting, most overall natural looking style of lift that can be done. And that is my way of reshaping the face back to where it was originally. Now, there's other changes that are happening related to sagging. There's sagging of the upper eyelids, lower eyelids, elongation of the top lip. So I do an upper blepharoplasty, lower blepharoplasty, or skin pinch, and a lip lift to address all of that elongated soft tissue. Then, when it comes to volume, we'd use fat transfer to restore and refill the face back to where it was, not to a new look. And skin, we typically put our patients after surgery or before, depending on when they come to us, on the Karam MD trifecta, and they stay on that basically forever after surgery. And for those who consult with me early, they oftentimes will get on that right after they book their surgery until the time they have their surgery. But at the time of surgery, if their skin requires it, we absolutely will use a laser. I like the Cyton Contour TRL, which is a resurfacing laser that treats the entire surface. It takes about 2 weeks to recover, which is around the same time it takes to recover from the surgery. So long story short, I do treat the skin in every single case, either topically with a trifecta or laser-based with the Erbium YAG Cyton Contour TRL. All right, so let's look at question number two. What makes a good candidate for a facelift? So this is what I tell everyone when they're considering whether it's the time or not. And it really, age doesn't have anything to do with it. I actually did a number of Instagram videos and posts about the idea that we're seeing younger and younger people coming in for vertical restores, and not because we're just being loose about our criteria. It's because just the fact that they're young doesn't mean that they don't have laxity. Some people genetically just start to sag a little bit more early. So we're talking about late 30s, even early 40s, there's that group. But the average person, that's kind of those are outliers for the most part, but they're there and we treat them the same way. But the typical patient is entering menopause, perimenopausal, late 40s, early 50s, and they're starting to see the soft tissues start to sag. And what that means is you start to see heaviness in the lower half of the face, heaviness in the mid face, corner of the brow starts to sag, neck starts to sag. And what you do is you're doing this all the time. You're kind of lifting your face back in the mirror and you're like, oh gosh, that looks so good. That is right then and there a sign that you're technically ready to have a vertical restore. Now, of course, I have to confirm that. You send me your pictures through the consultation portal. I take a look at that and I say yes or no. Some people are a little premature. They jump the gun a little bit too quickly on that. But bottom line is we'll assess if there's a physical change combined with your observations, your emotional desire and need to get this sorted out, that makes a good candidate. So when you feel ready and you actually are ready, those two things together make a good candidate. Question number 3, do we use general anesthesia? So this is one of the things that makes our procedures pretty unique is we typically, when I say typically, I mean 99% of the time, use local anesthesia with IV sedation. That's our default. That's the way we do it day in and day out. Once or twice a year, somebody comes in and says, you know what, I really want to be put under anesthesia, complete anesthesia, so we'll do it that way. That's not that I have a preference one way or the other per se, but having said that, like if, you know, when my wife has her procedure and every other doctor I've ever treated, including anesthesiologists, we all prefer IV sedation because it's a lot safer. You eliminate the risks associated with general anesthesia, and those are the risks that can potentially land somebody in the hospital. So once you eliminate that risk and you can do it under local with IV sedation, your risk profile is much more limited and the overall procedure is way safer. So answer is no, we don't normally do it under general anesthesia, although we have the capacity and capability based on our facility to do it that way if that's your desire. Thankfully, most patients do not desire that way and they like to do it under local with IV sedation, which makes me feel better and safer that I'm doing it that way for them as well. Question number 4, does the neck lift portion of the vertical restore address crepiness in the neck? So basically, this is what it comes down to. If you put your fingers here and you go up like that, right, you're gonna see your neck is gonna elevate and a lot of that loose skin is gonna tighten up, including, you know, central bands and all that kind of stuff. So your fingers here, you go straight up like that and you can see all that improve. Now, crepey skin is a little bit more complicated in the sense that there is a component that some skin is just thinner and more crepey to begin with. What we do as part of the vertical restore is remove all of the loose skin and tighten up the deep fascia. So what's gonna be left is the minimum amount of skin you need actually for moving your head side to side and up and down and all that kind of stuff. But the quality of the skin remains the quality of the skin. So if your skin is crepey naturally, it's gonna be a heck of a lot better, but there might be some crepiness, especially when you pull your head down and all that kind of stuff. So long story short is it makes it a lot better, but there may be some crepiness in the nature of the skin. And what you need to do before, like literally starting now and after, is really start taking care of your neck skin by promoting collagen synthesis. And what that means is sun protection is huge. Really be mindful about sun. Use topical things. We recommend the trifecta. Our patients use it on their neck. That's one of the cool things about it. You don't need like a separate neck cream, but basically you want things that are going to stimulate collagen. So retinols, vitamin C, growth factors, etc. at the cell level. And then in addition, if you really have a propensity towards thinning of the neck skin, I recommend things like microneedling and things like that to repetitively injure the surface of the skin in a controlled way to stimulate collagen so the skin gets thicker as time goes on. So long story short, definitely helps with crepiness, but it's not the full answer to it. Now this question comes up a lot and this has nothing to do with the vertical restore, but it has a lot to do with our practice. I use the terms lower blepharoplasty and lower eyelid skin pinch. So basically a difference there is that a skin pinch is exactly what it sounds like. I'm just removing excess skin from the lower eyelid, because remember back to that concept that our face is elongating and skin and fascia are getting longer, which means they're having excess amounts of it. So a skin pinch is just taking out the excess skin that has evolved as a part of the aging process. And what a blepharoplasty in my practice and my definition of it is where somebody has puffy bags under their eyes and we're gonna go through the inner eyelid, a transconjunctival approach, remove the fat pad from the inside and then come on the outside and then we'll still remove the skin, we'll pinch the skin. So it's a combination of a fat removal and a skin pinch. That's what we call a lower blepharoplasty in my practice. That's just a semantic that we use. And it differentiates from a standard skin pinch, which is just the removal of skin, but no need for removal of fat pad. We actually did a really great video on lower eyelid rejuvenation very recently, so take a look at that if you want to learn more about lower eyelid rejuvenation and management, the way I do it. Is it best to lose weight before a vertical restore? Will that give you the optimal outcome? So here's what it comes down to. I always say it's ideal for you get down to your sort of like real weight, right? I mean, just because somebody is overweight doesn't mean that even if they lose the weight, they're going to stay at that rate. It's a sort of a reality, a sad reality that weight is hard to manage. So I don't really want somebody to arbitrarily and temporarily hit like this rock bottom weight and then, months later, a year later, they're back up to some other weight. And the reason is because areas like, for example, the neck, if you go in there, for example, and remove a fat pad in somebody who's heavier, and then they lose a lot of weight, you could end up with hollowness in this area. You could actually lose a little bit of excess. It changes, right? I mean, the weight can fluctuate a little bit. On the other hand, somebody loses a bunch of weight and you can't see the fat pad there, and then they gain weight, and now all of a sudden the fat pad's there, where you would have taken it out if they came in a little bit heavier. So what I really want to see is somebody who's at their ideal weight. Now, the other reality is, as we age, our face doesn't harbor that much weight, unlike it does when we're younger usually. So many times I'll make a call. Like if it's somebody who's their body's overweight, but their face doesn't look like it has a lot of weight, I won't even bother telling them to kind of lose weight or not lose weight. We'll just go ahead and treat, because no matter what, it gets a huge improvement and much better. What I've seen also is that when people do lose weight after a vertical restore, because the fascia is so tight, etc., that their neck and their face actually do shrink down, but their soft tissues don't sag. Of course, we're talking reasonable weight shifts, like 10, 15, 20 pounds, not like 40 or 50 pounds. I don't know what would happen there. But in that kind of category of 20 plus pounds, I don't really mind you not being at your ideal weight. So what are the risks and complications with vertical restore or any other type of facelift? What are those associated risks? So this is a great question, actually. So you got to remember, there is no procedure on the planet that is risk-free, right? I mean, you just gotta go into any type of procedure that you're having done, whether even as a filler. I mean, you could nick a blood vessel, you could get into a blood vessel, cause occlusion. I mean, anything, big or small, has a risk of complication. And facelift is surgery, so there's always gonna be a risk for infection, there's always gonna be a risk for hematoma, seroma, all these other things. The big risks that come along with facelift surgery, and specifically deep plane surgery, the facelift surgery in general, most of them are done under general anesthesia. So a lot of that risk is going to be associated with general anesthetic related complications. And those are things, you could have drug reactions, you could have problems with the airway, this and that could land you in the hospital or in the ICU or something, much worse. So that's kind of the big stuff. The other big part comes down to, damaging facial nerves. It can happen through a regular facelift, it could happen through a deep plane facelift. Now, I don't want to make this into like a scary topic, but at the end of the day, you got to pick your surgeon carefully, because not only is your appearance going to be dependent on their outcome, but also your risk and complication. So when a surgeon does a procedure once in a while, it's very different than a surgeon who does it every single day. They are going to be much more familiar with the anatomy. They're going to be much more aware of how to avoid risk. So everything that you can possibly imagine that I just said can happen. The risks are extremely low with surgeons who are highly experienced and are doing the surgeries over and over again. Like for me, I do this twice a day, 4 times a week, been doing it for nearly 20 years. I cannot imagine all of a sudden losing my way and being in somewhere where I shouldn't be and then hurting some nerve or some other thing like that. But can it happen? Of course it can happen. It can happen every day that you're operating. That's why your full attention and full focus has to be there. Now, there's certain things like infection and hematoma and things like that, like you could do your best job, but they can still happen. And if they do, then you gotta just simply treat them. So these aren't like devastating, reversal type stuff. But then a lot of that stuff, we do things to avoid them from happening. Like we put patients on certain vitamins and minerals and herbal things that decrease inflammation. We increase the ability for blood clotting so that you don't bleed too much. We tell you to stay off of certain things that can make your blood too thin. There's a lot of things that we do to increase the successful outcome and decrease risk of complication. So know that all those risks are real. You are trading off a high potential benefit for hopefully a low risk. So this risk reward has to be taken into consideration. And then of course, anything like related to scarring, hypertrophic scarring, all that kind of stuff, that's partly technique dependent, partly your biology dependent, partly just happen chance that, those things can happen. But again, many of those things can be treated with scar gel and injections if you do get a hypertrophic scar, etc. So know that nothing is free of risk, but hopefully your benefit is going to be so high that taking that risk will be worth it. That's kind of how we look at it. So this is a great question, and it's why do most of our outcomes include a fat transfer with the vertical restore? So remember what we said earlier in the very beginning of the video, you are sagging and losing volume at the same time, and your skin's starting to age. So all these things are happening together. So my thought and my general kind of philosophy when it comes to facial rejuvenation is that we're trying to take a linear rewinding type step back towards where you were before aging took place. What that means is the soft tissues were up higher and your face was a bit fuller. So if we're gonna make you look like you used to, then we got to reposition the soft tissues and refill the lost volume. And that doesn't mean putting a bunch of fat in your cheeks and making your cheeks bigger than they've ever been. That just simply means in areas where we know that there's gonna be volume loss, like the temples, under the eyes, above the eyes, around the mouth, the lips, these areas just need a little bit of volume placed back into them so that the whole face looks a lot like it used to. And so my sort of, I would say my power combination is the vertical restore and fat transfer. And I've been doing fat transfer from literally day one as a fellow. And I've not seen a bad outcome as a result of it. It's all been very straightforward in terms of the outcomes, the expectations being met, and never running into problems with like lumps and bumps and being overfilled or underfilled or any of that. It seems to be, in my hands at least, a very reliable and very safe procedure. It's the cherry on top of an otherwise really great repositioning procedure like the vertical restore. So I love fat transfer for that reason. And I think loss of volume makes you look sickly, makes you look tired, makes you not look as healthy. And so when you put volume back into a face, it's very pretty and it's also very much reminiscent of what the face used to look like. That's why I pair those together so often. So how long is surgery? Now, vertical restores take me, just a vertical restore without all the other components, take me about 2 hours to perform. The whole surgical time, between starting and stopping and all that stuff will probably be about 3 hours. Now that's, in the grand scheme of things, relative to the time it takes other surgeons to perform these surgeries, it's pretty quick. Most surgeons take, 4, sometimes 5 hours to perform a procedure like the vertical restore, meaning that they perform deep plane surgery and neck lifts and all that stuff. But I'm doing this day in and day out. I'm accustomed to the anatomy, and therefore it doesn't take me as long as it would have in the beginning of in my practice. So vertical restores take me approximately 2 hours to perform under local with IV sedation. When we combine it with everything else, we're talking about 3 to 4 hour procedure. And that's not including the time it takes to numb somebody and the time it takes to recover and all that other stuff. So how long is recovery? How long should one expect? So recovery, and we've shared tons of recovery and full patient journey videos for you to be able to see the process of recovery. And basically what it comes down to is the first week is rough. You look crazy, swollen, et cetera, et cetera. And then after that, between week 1 and 2, things really start moving quickly. And typically by the end of 2 weeks, you're kind of like quote unquote restaurant ready, where you don't look, you're not gonna scare any little children in a grocery store type of thing. But at the end of the day, the results keep getting better as the days and weeks go on thereafter. But typical recovery for most people to get along back to work and be in social situations is typically around 2 weeks. And what we do to ensure that process is we put patients on it, like I said earlier, a series of vitamins and herbs that they take 2 weeks before, 2 weeks after. We have certain rules of things that you should do and not do. We have compression sutures that we put in to decrease swelling and all that kind of stuff. So there are many things that we do to increase or improve the chances that that recovery will happen during that period of time. And it typically does. Of course, there's some people that go faster, some people take a little bit longer, but for the most part, 2 weeks is a good window to get back into the swing of things. All right, so the next question is, how do I preserve facial identity? So this is one of the things I would say probably draws the majority of the patients to our practice in the first place, and to the vertical restore, et cetera, is because the outcomes that you see, the before and afters, no one looks different. They don't look like a different version of themselves. They don't look like they come in one way and come out another way. They simply look like a younger version of themselves. All that aging has been erased off their face, and everything looks natural. And the game we usually play is like, if you just look at the after photo and forget about the before, don't see the before next to it, you would never know that this person has ever had surgery. And how is that accomplished? And quite honestly, I would just simply say that part of that's technique, vectors and technique, and being able to adjust the technique to the person's particular face and where they were. The combination of the procedures that are done, using fat transfer and upper eyelids and lower eyelids and lip lifts and all that kind of stuff, so that you have a face that kind of is balanced and harmonious with one another. And then at the end of the day, I hate to sort of say this, but at the end of the day, there is a talent component that's involved in this type of surgery like anything else. It's just like as a chef or a painter, or somebody has like a, an aptitude to make something, better than somebody else, I guess. My aptitude has always been to leave faces looking completely natural and leave them looking like they've never had any surgery done. That has never not been my outcome. I mean, literally from facelift number 1 until the one I just did yesterday, every single one of them always looked natural and unoperated. And that's really been, I think, the secret of my success and why people come to us in the first place, because that's what they want. And I don't blame them. And that's what I would want too, is to look like myself, just get rid of any aging that takes place. So that's the combination. I think it's partly the surgeon, partly the technique. You put it together and you have a consistent, replicatable outcome when it comes to preserving your identity and not looking like you've had any surgery done. So choose your physician and surgeons wisely when it comes to that. Next question is, what's the best age to have a vertical restore? So age literally has nothing to do with it. It's about facial shape. If you have somebody in their 30s, and we're seeing more and more of these people knocking on our doors because they realize that the fillers and all that other stuff isn't gonna correct this. But if you have sagging of your jawline and heaviness in your midface and you're younger, well, we need to put that back up if you want to look like a younger person, right? If you're older and this all just started happening as a result of kind of like that normal aging related transition from perimenopause to menopause and thereafter, well, we want that all back up. So age is most commonly in the late 40s, early 50s. That's probably the bulk of our patients when aging really starts taking place, and then the alarms go off and all that. But we're seeing younger patients also who just genetically starting to head in that direction. And these are the people that either if they do nothing, by the time they're 50, they literally look like they're in their 60s. And they're also the people who, if they're trying to use fillers and all that kind of stuff aggressively when they're in their 40s, they're gonna look overfilled and really done by the time they get older. So very, very important to understand that age has nothing to do with it. It's the anatomy. Again, if you're doing this all the time and it looks like it's improving the facial shape, that's typically the age. But statistically speaking, we're talking about late 40s, early 50s and beyond. And then this unique cohort of younger patients who are now just skipping all that non-surgical stuff and wanting to go straight to surgery and get their faces in a more youthful position because of their genetics. But in general, what I would say about that is that the earlier in the aging spectrum you treat it, the better. The easier you get back to that younger looking self, and the less of a gap there is between looking much older than looking younger. So it's kind of like, if you're trying to keep it kind of casual and not let everyone know about it, well, that's one of the advantages. The other advantage is super personal. Like, if you're bothered by it now, you're gonna be really bothered by it 10 years from now. So between now and 10 years from now, so why not eliminate the thing that's bothering you sooner rather than later? There's literally no disadvantage of doing it that way. In fact, younger lifts actually last longer than waiting until like you're in your 60s and then getting it done. And we see that all the time. In fact, I've done a lot of posts and videos on that particular topic as well. So what does it mean for a surgeon to be board certified? Well, on one hand, it means everything. On the other hand, it means nothing. So this is what it comes down to. Board certification is sort of like a standard. If you're a facial plastic surgeon, that means you did a residency in usually otolaryngology, head and neck surgery, then you did a fellowship in facial plastic surgery. If you're a plastic surgeon, that means you did a residency in plastic surgery. Sometimes you do a residency in general surgery and then a fellowship in plastic surgery. But bottom line is, those two specialties are the ones who are technically certified to do things like facelifts and things like that on people. So what that means is that you have the certification or qualifications to do it. That doesn't necessarily mean that a board certified facial plastic surgeon or board certified plastic surgeon, simply because of their certification, are going to be excellent or really qualified at doing facelifts. Same thing with noses, same thing with any procedure. What you ultimately want is, of course, that goes without saying, they should be board certified. Like, you don't want an OBGYN or some other specialty coming in and doing this on your face. So board certification, check, get it. Then you start looking for the next layer, which is you want to look for somebody who's really an expert in this particular type of surgery, who's doing this over and over and over again. Their practice is, for the most part, limited to what you're interested in. Because I know tons of board certified facial plastic surgeons or plastic surgeons that rarely do facelifts. So if you happen to be, going into one of their practices, you're probably not going to come out with the best looking outcome, because that's not what they do, right? They're qualified to do it. They'll probably do it for you, but they're not necessarily the best choice to do it. So that's just something to keep in mind. So what should you do to prepare for facelifts or vertical restore, etc.? So I would just say nutrition is really important. You want to make sure that you got a clean, good, strong diet going into it, good, clean, strong diet afterwards, high in protein, high in vitamins, high in minerals, all the things your body needs to heal from this. Obviously smoking, you gotta eliminate, like we won't even operate on smokers, or at least we won't do a full vertical restore on them. So you gotta make sure that you're quit smoking, vaping, all that kind of stuff, get all that out of the way. And then again, the other aspects that are just psychological and emotional, you gotta be totally in the know. You got to mentally prepare yourself for what's ahead so that you are ready to go and able to manage the ups and downs that are going to come with healing and the surgery and all that kind of stuff. So the more you know, and that's really a huge reason why we put so much information out there in the social media world and YouTube and Instagram and all that kind of stuff and all these channels that I participate in, because I want people to be really, really aware of what they're getting themselves into, and that helps a lot. I think our patients are probably the most prepared patients you could possibly have, because not only have they seen people go through it, they hear me talk about it, and we put out a lot of private videos on the topic, and we have a very extensive preoperative process within our office, all the stuff to prepare you for what's ahead so that what's ahead doesn't feel overwhelming and surprising. Finally, and I'm sure there's other questions, so please drop them in the section below. The last question that I'm going to answer today is, how many times can you get it done? And if you get it done more than once, are you going to look weird? This is a common question that comes up. So the answer is simply this. You can look weird by having it done once at any age, just because the person who's doing it doesn't use the right techniques and doesn't know what they're doing per se, and you're gonna end up looking weird. We all know what weird looks like. I mean, you spot weird the second you walk into a restaurant or any type of room. It's like, boom, that person had a lift, that person looks weird. That's not what you want. In that same room, there could be 4 or 5 other people who had beautifully done, eloquently done lifts, and you would never know them apart from anyone else in there. They just look great. So the bottom line is, if it's done once, the right way, you're golden. If it's done the second time, the same right way, you're still gonna look great. And you're not gonna look like you've had anything done. So bottom line is, it's not about the number of times you have it done. Although if you have it done the right way, you should probably not need more than 2, maybe 3 in your lifetime. If you're lucky enough to live into your 90s, for example, a couple starting at like your 40s or 50s, and then one then, and then another one 15 plus years after, and then another one thereafter. I mean, maybe that's all you really would need. But the reality is, sometimes people end up with these surgeries that are not quite effective. So they get a facelift that's kind of like partial, or it's abbreviated, or it's like a standard facelift. There's just like a little bit of tuck and this and that, and then next thing you know, a year or 2 goes by and you're back to square one. That's super frustrating for people, and we deal with those all the time. That the person is going to need another one if they want to get their outcome even as early as 2-3 years after their first one. So the underlying issue is, you want to get it done right the first time. And if you haven't had the opportunity to get it right done the first time, you come in, you get it done with somebody who knows what they're doing. Ideally, I think like deep planes and things like that are just going to give you much more durability, but someone who knows what they're doing. And then after that, you're going to be good to go for a very, very long time. Like, I just had a patient the other day, she was 67, her last lift was 22 years ago, and she looked amazing. I couldn't believe that she was a 67-year-old. I mean, I literally just had to tuck her up a little bit, and she looked amazing. I added some fat and all that just to kind of round out everything out to make it look super youthful and natural. But at the end of the day, because she had it done in her 40s, she looked amazing at 67, and who knows, maybe that might be the last one she needs really going forward. So bottom line is, do your homework, do it right the first time. But if you miss the opportunity to do it right the first time and you want to get it done again, don't worry about it looking weird, just pick the right surgeon. All right, everyone, that was a lot of fun fielding all these questions for everyone. I hope that helped give you more perspective on specifically the vertical restore, but a lot of this applies to a lot of different types of lifts, and the topics are relevant no matter where you go. So if you have any other questions, drop them below. As you can see, I do pay attention to these and love to answer them. So drop them in the comments below. If this was helpful, let me know as well. I'd love to hear that. And if you haven't already, subscribe to our channel, share this with some friends and family. This is a really evergreen, really great discussion on these topics. So share it along, let your friends and family know about it. Until next time, guys, Dr. Amir Karam, thanks so much.